Thank you, Dahlia. Hi, everybody. I'm Lexi Nolan. Good to see you all. Thanks for joining us today. We just wanted to give you a little update on what's going on with the budget. For anyone who didn't hear, the county commissioners did adopt the budget with the public health cuts. So we are going to need to proceed with identifying opportunities for savings and revenues. The way that we would like to do this is really to gather ideas from staff first and see how far that can help us get. But we also want to kind of accelerate some strategic budgeting processes that will help us really be set up for the future so that this isn't a one-off. It's really looking down the road a bit. We're going to kind of roll it out in 4 phases. The first is really about low-hanging fruit. And I've got a visual I can show you if you want to see it. Let's see. Sorry, I thought I had it easier here. All right, here we go. Okay, so I'll make this bigger. The first phase is really easier decisions, things that aren't going to challenge our programming and that we might be able to just easily pick off. And that this timeline is a little bit flexible, so we already need to move this. Phase 2 is really data collection and staff and program change proposals by the end of March to the Board of County Commissioners. So the idea is after we get information from staff about proposals and we see what the potential additional reductions are, that we would talk with the county commissioners at that point after our 23 books have closed. So that we are working with concrete data and also give them a chance to make a budget amendment if they're inclined to do that based on where we're going to need to cut programming, either staff or operations. And then phase 3 is really about updates related to the legislative session. So after the legislative session, we may have some additional information. I would also at that point like to get clarification from the commissioners about the expectations around the S-tax, HHS funding, et cetera. Eliana, can you? Thank you. Okay. And then also finalizing the 24 budget with the Board of Health at that point. It's later than we usually do it, but we have a little bit of an unusual situation. It'll take us a little time to get a handle on our full budget for 24. And then phase 4 is kind of after the study session with the Board of Health. We know that there will be additional information about local WIC matching funds that may affect our 25 budget or our county ask, about indirects. That's when we set our indirects for the next year, about the county funding, and about any further adjustments we need to make for the Board of Health resolution. And I will tell you that in this process, we've been identifying a lot of we've been recognizing a lot of spaces where our systems we don't necessarily have the same interpretation of information in our systems, and we don't have written expectations with the county about what their expectations are and ours are. And so we'll be working towards those kind of strengthening of governance and structures as we go forward, so that we don't get into this situation again. I think it's partly a function of having 3 fairly new commissioners, 1 very new commissioner, who don't necessarily have the historical knowledge about how we do stuff in public health. And Catherine is going to talk a little bit about Colin Merritt and maybe a little bit about the budget. And we really just wanted to hold this space for you all to share a little information about where we are now and kind of what you're going to see coming forward, and making sure that we are using a participatory approach with staff and that you all really have a chance to weigh in the first round. So feel free to throw questions in the chat or to raise your hand, and I'm happy to turn it over to Catherine.
Thanks, Lexi. Hi, everyone. Catherine Palmer. I use she, her pronouns, and I am your Director of Admin and Finance here at Boulder County Public Health. So before I switch over to Merritt and Cola, I just want to see if there are any questions related to the budget. And just a reminder that at the Board of Health meeting next week, we will be talking about the budget and would ask for you all to tune into that. And I believe it is an in-person one, so you can either come in person or join us virtually to hear about the budget as well. I'm going to give a second just to see if anything pops up.
You have a hand up from Martha Robbins, it looks like.
Okay. Martha, do you want to go ahead and go? And I was reading the questions that are in here from Christina and Daniela.
Yes, thanks. I'm one of the immunization nurses, and I just was reading that one of the commissioners kept pointing out that the public health hasn't spent all of its budget, and I was wondering how much that is and what area, and if you could address that.
Yeah, thanks, Martha. That's a great question. And it looks like Christina had a very similar question. So what I can share with you is that our budget is different than other budgets in the county in the fact that we are largely grant funded. And as many of you know that work in these grant programs, there are times where our budget looks like it's going to be something amazing because we have some promises from our funding sources, and then it comes around and we don't get as much money as we were hoping to. This is an area of clarification and education that we need to have with the Board of County Commissioners to acknowledge that when we create our budget, it is often putting into place those grants that we think we may get, but then we do an amended budget which acknowledges what we think we're going to bring in. The other aspects to acknowledge is that even though we're in December, our invoices are still processing from October. So we typically see invoices come in through March. Again, this is another area of communication that we can provide clarification on. And actually, just to assist with that, we will continue to pull the Oracle numbers. And we appreciate all of you getting your invoices in. I've seen a slew of invoices coming in recently, and I feel like that's a great response to the need that we have right now. So we do plan to spend down. It may not be all of the numbers that we had in the budget, again, because that ties back to our grants and the fact that those numbers do shift with the overall amount that we receive in. I hope that helped answer the question. And then Christina, you had a component around ARPA funds. And what I would acknowledge is that we do not plan to fully spend down all of the ARPA funds. So you could say that is a component of it, but I wouldn't say it's a large amount. And that's just because we had to limit some of the projects that we could work on so that they stayed solely focused on COVID response. And I'm speaking solely to the COVID ARPA funds. What we do know is that those ARPA funds via Boulder County ARPA group will roll over to our other ARPA projects, including Family Connects and MBH. So we haven't been looking at those from the same perspective that those funds will not continue with us. Instead, that we know we'll spend down what we can towards COVID ARPA projects and then have a conversation with BOCO ARPA about how to roll those over. I'm not sure, Daniela, about that question, so I'll read it in case for those that are being recorded that can't see it. says in the article that came out a few days ago regarding the cuts, they mentioned that we, public health, doesn't have as high of revenue as other departments, hence why they only cut our program. Did I understand that correctly? Is that a big reason they cut us specifically was because of our lack of revenue sources? I can't speak to that one specifically. What I would acknowledge is compared to some of the other departments, we actually have a fairly high revenue. And we have a stronger revenue source not coming solely from the county, where a lot of our departments do solely rely on county funding for their departments.
Danny, you might have been, were you connecting that when Commissioner Stoltzman said that we needed to raise our fees? Is that where, is that what you were connecting with your question?
Yeah, there was an article that came out, one of the ones that Melanie sends out that someone wrote about it, and in there talked about revenue sources. And I think that was the commissioner that stated something like that. So I just wanted to make sure I understood.
Yeah, so I think this is another great area for education. Public health doesn't have uh, a lot of control over fee revenues that would make much of a difference, except the OWTS fees, which we've been working with Aaron and the team for several months now. And a proposal to raise the fees is coming to the Board of Health on Monday. That's really the only fee revenue area that we have control over that produces substantial fees, from my understanding. We're hoping that, those who control other fees like restaurant inspections will be raised soon. But again, that's not a space where we make the decision. So that's another kind of space where I think some additional education would be helpful.
And I just want to acknowledge appreciation for my teammates in this space because they all know how tired I am. And I will say, Daniela, when I read your question, I actually read it as like county funding, grant funding, all of those types of things. And Lexi, thank you for clarifying revenue around fees and other components that are coming in. So it takes a village, and we're really bringing it together right now. So thank you everybody for your patience with me, and I appreciate everybody's support in this space. So I'm going to keep going. There was a comment in here, just so everybody is aware, that the meeting will happen at the Justice Center. Carol, you asked a great question. How many total FTE are county funded? I was trying really quickly while Lexi was answering the question to find it, but I don't have it at my fingertips. I can provide a response to that soon. And I'll also provide verification on the previous data prior to COVID, just so we can see a historical shift over the years. Okay, Erin, I'm reading yours. It says, will core public health services be part of the, and thank you, Erin, for providing the reference point, be part of the strategic budget review with regard to the request for more financial transparency. It's trying to keep public health services out of the county political agenda, part of the conversation. For example, a politically controversial service being targeted for funding reductions with commissioner turnover. That is a good question. What I would say is part of the phases that Lexi is acknowledging is really building up a strategic approach about how we consider our budget cuts. And it will include things like what is statutorily mandated, what aligns with our strategic plan, what aligns also with Boulder County vision, as well as other aspects that we need to meet with the CHA, and I could keep going. But acknowledging that to do this right, we need to consider all of these factors and how they impact our overall ability to meet the needs of the community. Okay, so Laura said, just to clarify, based on the commissioner's last meeting, public health was the only department whose budget would be cut. One of the commissioners said that for us to not get cut, other departments would have to be cut. One, am I understanding correctly that indeed we are the only department with a budget cut? And if so, can we get a list of all the department's budgets for 2024, 2023, 2022? I am curious what it all looks like. That's a great question, Laura. So we can provide access to the Boulder County budget book, which will show you all of those figures. What I would also, and it goes back numerous years, I think it actually goes back to 2019. So you can see year over year the changes. What I would also acknowledge with your first question is yes, we are the only one to have a cut to our base budget. Where other programs saw cuts or did not get funding was in requests that they made. So they made requests for additional funding. Go ahead, Lexi.
No, I'll say something when you're done. Go ahead.
Okay. So they made requests for additional funding for either operating capital expenditures or FTE. And those were either not approved, were cut, or they approved the FTE but did not approve any funding behind the FTE. So go ahead, Lexi.
No, I was just going to mention that Parks and Open Space was asked to use their sales tax reserves for 1 year to fund their department because they had built up so much reserves. So in some senses, that's similar to our situation. The county saying we're not going to give you money next year. But yeah, ours was a little more impactful because we didn't have that extra money behind it.
All
Hey,
right.
Lexi, we can take some of their extra off their hands to do them that favor.
Wouldn't that be nice?
Yeah, I mean, it's the least we can do.
All right, I know we want to get to merit, so there's 2 more in here that I'm going to acknowledge. If you have any others, do put them in the chat and then I can follow up with you later like I will with Carol's, but I do want to get to merit because I know there's been lots of questions in that space. So Rachel has one in here that says the Board of County Commissioners has mentioned duplicative services. What will the process be for working with HHS and CAS on this? And Lexi, do you want to take that one?
Sure, I'll take that one. Yeah. So there's a lot of planning processes going on right now, and it may be that we need to shift some deadlines or some expectations on some other work that we've been doing. So for instance, I think let's suspend the December 15th deadline for the roadmap inputs, and we'll pick that back up in maybe late January, so that we can focus in more on getting information from staff. And the way that process will work, and then I'll answer Rachel's question, the way that process will work is that divisions will work together to identify what in their division might produce some savings. And Darren, Catherine, and I will attend some leadership team meetings to get that work jump started off on the right foot. And then but as this is the tension, right? It's hard to know what makes sense, the strategic direction to go in, if we don't know exactly where some of these duplications are, or if there are duplications, or if we just need to better explain how our programs fit together. So Susan Caskey, Robin Bohannon, and I have been working on the HHS Community Services Public Health areas that were identified by the commissioners. And what we'll be doing, I'll send it out next week, is a spreadsheet on to teams that work on specific issues that have been identified as having potential duplication, so that we can collect a little bit of information from you about those programs. And then what we're going to do is we're going to map the programs to see if there is duplication, and if there is, maybe they are complementary, not duplicative, those kind of things, and bring it back with some recommendations to the commissioners, probably in late January, maybe February for the recommendations. There is also our A&F refresh that's going to be rolling out in January. And that's a really important piece of work for us to do together, because that is what's going to help us to get some efficiencies, to really streamline grant writing and contracting processes, et cetera. So that's a higher priority than the roadmap right now. The strategic plan process, I talked with Elise and Rachel and Dave this morning, and they are aware that we may want to make some adjustments in exactly the expectations, but we also have some plans for how we can make sure that we're not overwhelming the teams with too many requests for information. right off the bat, because we want to be conscious that, you know, every time we ask you to do something, that's time away from your programs. And we want to be sensitive to that. The other thing that I want to just stress is that we're not going to make any final decisions for a few months in these spaces. So I don't want anybody to get anxious. There will be lots of communication, opportunities to provide feedback. So what we're mainly trying to do right now is the planning work to make sure that all of these kind of different pieces of decision making are coming at the right time, within, you know, kind of the time that we have to manage this. All right,
Okay.
over to you.
And I see one more note from Dina. I don't believe this is a question, just a comment, which is there are 43 100% county funded laptops in our equipment database. Is there anything you wanted to speak to on that one, Dina?
Yeah, I just wanted to say that we don't particularly track if they're partially county funded, so I don't have that information. I only have information on the ones that the county actually replaces. So if you guys have additional information on like partially funded or where the funding comes from at one FTE to the other, we don't track that in our database. I just wanted to throw that out.
Thanks, Dina. Appreciate it. And I wish I was in your background. Okay, so I'm going to move over to Merit, but like I said, if there are any other comments or questions that come up related to this, please feel free to put them in the chat and I will get back to you afterwards. So we know that recently the memo came out from the Board of County Commissioners that discussed merit and COLA increases, and it raised quite a few questions. And thank you to everyone that provided questions. Those will be the ones that I'm responding to. So if I don't get to it, please put more in the chat. And a big shout out to Amanda and the personnel team who helped me draft these responses. So the first question we had is, are public health employees receiving the 2024 COLA increase? And just a reminder, the difference between the merit and COLA is the COLA is identified as $220 per month for a 1 FTE. And then the merit is considered an average of 2%, but ranges from 0.5 to 3.5% if you're an eligible employee. So with that in mind, I'll keep talking through this. So yes, our public health employees are receiving the 2024 COLA increase. These increases will be effective for employees as of the 12/26/2023 pay period. So that's where your January pay stub starts. And you'll see that in your January pay card. So, and these will be prorated based on your FTE status. So if you're under a 1.0 FTE, you'll see that 220 slightly be prorated based on that. Are public health employees receiving November 2023 bonuses? No, public health employees will not be receiving bonuses in November of 2023. Public health used all of our available funds from the 2023 merit pool and did not have any surplus to distribute out. Next question is, are public health employees receiving a merit increase in 2024? Yes, public health employees will be eligible to receive a merit increase in 2024. We are moving our merit increase to align with the county. This means that effective May 26th of 2024, which is the start of the June 2024 pay period, all eligible employees will receive a performance-based merit increase. Public health will assign a straight 2% across the board for eligible staff this year. In 2025, public health will continue to move more in alignment with the county to assess performance on a merit range basis. So just to provide clarification in that space, the range that was given by the Board of County Commissioners was 0.5 to 3.5. And what they asked is for it to be based on performance and for the departments to come up with a performance approach. This is a lot of work to do in a very short period, especially without giving our staff notice. So we wanted to hold on one more year when we know that Amanda and the personnel team, as well as the supervisory team, are coming up with an actual performance standard and approach for our years to come. The next question is, why was public health not included in the original 2024 merit increase memo for departments eligible for the merit pool? Public health reports directly to the Board of Health, creating a different reporting structure than the majority of county departments, as well as elected official departments. Public health staff were accidentally included in the email. The clarification email came out advising why certain departments were not originally listed as eligible, primarily because it is upon the elected official or department head, Lexi Nolan, to decide and communicate the process for our 2024 merit increases. And then the last question that we did receive ahead of time is, can you explain the merit pool at the end of the year and what to expect? For most departments, when merit increases happen in the second quarter of the year, the amount distributed across staff varies between 0 to 3.5%. That's for this year. And there is a possibility that not all the merit pool available will be used when funding the increase to staff salaries. This can happen for a multitude of reasons, depending on where they fall in that range, as well as staff vacancies and so forth. But for public health, because our funding was cut to no longer fully cover the cost of county-funded staff, it is very likely there will be no merit pool at the end of the year. If by chance we do find we have additional funds available from the merit pool, we will look into awarding a one-time end-of-year bonus to eligible employees. Should this occur, more information would be distributed to staff on what the bonus would be and who would be considered an eligible employee, along with the criteria that goes into being eligible. So those are all the initial questions that we received. I can see out of the corner of my eye that the chat has been flowing, so I'm going to take a moment and just look over there and see if there's anything that I can address. Okay, so Georgia, you put a comment in that said, I thought COLA was 3%. I think we'll have to go back into our budget to correct this. Yes, we already have a plan in place to go ahead and do this. The reason they were listed as a 3% merit or I believe it was 3% merit, 2% COLA, but they could be flipped, is because that is what HR initially told us the plan would be. Actually, they told us it was going to be higher. They said it's 3.5 for both of them. So for some, we put it in as that. Then they cut it back to the 3%, 2%. So we went back in and shifted again. And then we got this update. So now this is the finalized, formal, approved merit and COLA that the Board of County Commissioners and HR have decided on. Amelia asks, how will the Board of Health be participating with this process? Oh, I think Amelia's is related to the budget. Okay, Amelia, I'm going to hold on yours just a second and go back to more of the merit. Okay, thank you, Amanda. And thanks, Georgia. Okay, so I want to see, are there any other questions related to merit and COLA, or did that answer the majority of the questions that came out after the memo? Okay. Well, I appreciate it. Amelia, I will come back and answer yours because I know we are at time. I appreciate everybody's willingness to, yes, Shauna, that is exactly correct. And it's end of May, so it starts in your June pay stub.
So the COLA starts in January and the merit starts in late May.
Mm-hmm. Yep.
And the COLA is $220 a month per person, per FTE. And the merit is 2% of your salary.
Yep.
And those were decisions that were made by the commissioners.
All right. Well, with that, I just again want to appreciate and say thank you to everybody that was able to hop on. If you have more questions after the meeting and it's all settled in, feel free to just pop them in the chat. We'll collect them and respond back. And I hope you all have a good rest of the week and that you will be able to join us for the Board of Health meeting because we would really appreciate participation. We know it is after hours and it's not always feasible for everybody. So it will be recorded if you're not able to actually make it.
Thank you, everyone, and big thanks to everybody who's been doing double time work lately to get us back on track.
Thanks, everybody.
Take care.
Bye.